Hello, I'm Dr. Dennis McKenna. I'm joined today by Kevin Zhang. Kevin, great to have you here.
Thank you.
Kevin, of course, is our Chief Nursing Officer, has been at Albany Med now coming on 2 years.
Yes.
Boy, time goes fast.
That's right.
And you've been with me a few times in the past. We're so happy you're here today. Today is Monday, February 3rd, giving you the update from Albany Med. Let's begin, Kevin, online. Employees can participate in the Best of Times Union. This is the first step of a two-step process. First, they identify who's going to make the final list for the actual voting. But there's an opportunity to make sure that Albany Medical Center Hospital and our urgent cares are on that final list. So if you haven't voted, we encourage you to do so. Once we get to what we hope will be that final list, then we'll talk about it again and we'll encourage even more voting at the time. But let's get the hospital and the urgent care onto that Times Union Best of list.
Right. Let's be proud and nominate.
For sure. Speaking of proud, speaking of best of, we have, I think, undeniably the best vascular surgeons in the entire region. I've worked alongside them for my entire clinical career here, 25 years. They've operated on family members and friends. They are really an incredibly talented group led by Dr. Clem Darling. Very pleased to announce that they brought on board a new physician, Dr. Amanda Kistler. And Dr. Kistler will be seeing patients in 2 locations, 391 Myrtle, of course, but also down in Kingston. We have a very significant presence down there in the south. An expert in peripheral arterial disease, as well as aneurysm repair, and obviously all the other vascular procedures. Kevin, vascular surgery here also obviously has a significant dependency on our nursing.
Right.
And I know we have nurses who specialize in vascular surgery as well.
Absolutely. Not only the procedure areas and, of course, our clinic area. We have 2 separate departments that take care of vascular patients in the hospital. So absolutely a significant part of our organization. I actually glad to hear you say that Dr. Kistler would be able to see patients outside of Albany Med as well, because that's a good theme in terms of the access to care that I think we work really hard to provide care to our community.
You're exactly correct. It's always a thought that goes in as making sure we provide the right level of care in the right location.
Right.
Some people want to be in person, some want to be remote. We have patients who travel from the south, we have patients who travel from the north, and that's a perfect example of that. But I want to emphasize again that when we talk about being a tertiary care hospital, when we talk about the types of services we offer that no one else offers, whether it be neurosurgery, some of our vascular procedures, our children's hospital, it's very important to emphasize that's not just about the physicians, who of course are extraordinary, but in particular, I would say obviously the nurses are also specialized as well, and that's an example, vascular surgery, specialized nurses in that care as well.
Yes.
We had another Eye Care Award winner, always fun at our monthly meeting, our acronym CARE, Compassion, Accountability, Respect, and Engagement. A wonderful recipient, Shobha Gautam, who I think if you ever find yourself down in Choices Cafe at the register, recognize Shobha, described as just this wonderful glowing presence, positive, smiling, appreciative of her role that she plays significantly in our daily life here, and just a wonderful recipient, had some wonderful remarks. You were there.
Yep, absolutely. Yeah. She was awesome.
We congratulate Shobha. Another clinical area that we want to emphasize today, because it received an award, is our cystic fibrosis work. Cystic fibrosis, obviously a medical condition that affects patients often in the lung area, leads to some significant challenges with pulmonary conditions and other conditions. We have specialists here who help treat those patients. Again, pulmonary doctors, nutrition doctors, others. 2024 Outstanding Care Center Partnership Award from the Cystic Fibrosis Foundation. Again, an opportunity to emphasize not only the remarkable work of the physicians, but also the nurses who work in the clinic and care for those patients on our hospital floors.
Yeah, thank you for that, and Dr. McKenna. I know that population is special as well in terms of the disease processes. They are generally tend to be younger, and so it's difficult but rewarding.
Yeah, and when they come in the hospital, they require very specialized care, right? Because we want to be sure that often the infections they have don't spread to other susceptible patients. There's a lot of very disciplined work that goes on caring for that population, and I think our team here really does a remarkable job. So Kevin, annually I host open forums. We typically do them in the first part of the year, end of January, early February. The first one is on the calendar. In fact, these dates will be on the intranet. The first one is February 10th. at 2 o'clock in ME 700. But importantly, we do more than a half dozen of these. We do one in the morning. We do one in the middle of the day. We do one in the evening. We do one on the weekend. We do one at South Clinical Campus. We do one at 1275 Broadway. We do them all over the place. And it's not just me, but members of the executive team come and we answer any questions we get from the floor. It's a great opportunity to look back at all the things we accomplished in the previous year. And let's be honest, 24 was a pretty busy year with the EMR and all the work we did there. And then obviously it's a look forward to talk about the things we expect to accomplish in 25. So obviously we encourage you to attend in person. We also videotape one. So if you can't make it, you can watch as well. Awesome. I know you'll be there. People often have questions for you as well.
Yeah, of course.
So we look forward to having you there. We are publishing our budget for 2025, and this is where, Kevin, I'd really like you to jump in and talk about this. Importantly, the workforce needs to know that the budget that we pass in 2025, which is going to go in front of our system board this week, is a growth budget. It's a budget that says that Albany Med continues to provide indispensable services to the region and that we see more opportunity to take care of more people. But in order to do that, obviously it's not just growth in volume, it's also growth in workforce. And we have high expectations that we're going to continue to be able to recruit nursing for that. And I know that you have big plans. Those plans, I think, will be made more successful by the work you all did in 24, working with local nursing schools. So maybe we start there. What foundational steps did you and your team take in 24 to prepare us to be able to be aggressive in recruiting in 25?
Yeah, that's a great question. I can agree more that I think in terms of healthcare and in this region perspective, we talked about access to care. There's a lot of needs from our population, the community. And to your point, our workforce is the most important part of this piece to be able to provide those services. And in 24, we have done a lot of work, and again, geared towards for the years to come in terms of helping and partnering with higher education to have build workforce programs and pipelines to be able to educate the next generation. But at the same time, to get that fulfillment from our existing workforce, how to be that mentor to give back, that one, all of us at some point were taught by someone, mentored by someone, and really to do that now, reverse role. So those will continue to go. We had last year had an announcement with Russell Sage College, and we have more to come. We have signed a contract with SUNY Plattsburgh and expanding those partnerships, and more would come on that. And I will emphasize that absolutely 2024 was a growth year for a lot of things, but 2025 even more so, that we're going to invest in our workforce and really making sure we're the best placed, continue to be the best place to work.
Thank you for that. And we're metric-driven people, obviously. Just to remind ourselves, you might know the numbers better than I do. At year-end 2024, I think when we look at that whole year, we hired, I think, close to 300 nurses in 2024.
Over 300.
Over 300.
Yep.
Wonderful. And how do we do a turnover rate or vacancy rate?
It's a great question. Our RN turnover rate was about 3% less than national average last year.
So
lower.
In a better direction.
In a better direction. Okay. And our other non-RN workforce are a lot of our valuable workforce in terms of our PCAs, our PCTs, and a lot of our supportive support positions. We had the lowest vacancy rate since the year of 2020.
That's wonderful.
So before this, we've been talking about the pandemic and et cetera before coming on the camera.
Right.
It's been a long time, and I think so that's been a 4 or 5 year a period, and I do believe that last year was the best year out of them all in terms of metrics.
Well, that's wonderful. I mean, we knew that coming out of the Great Resignation that all hospitals throughout the country would have a multi-year journey to climb out of that. We still have work to do. We're dedicated to it. We're still focused on it relentlessly, on retention and recruitment. It sounds like 24 was a successful year. It sounds like 25 could be an even better year.
Yes.
So congratulations to you on that.
Thank you.
So we'll keep doing that work.
More work to do. Yep.
Absolutely. Speaking of congratulations, I don't want to miss this opportunity to congratulate Mary Alice Cullen, who has been, I guess, double or triple hatted for the last few years, serving in many important roles. You know, Mary Alice has a lot of passions. One of those passions aligns with one of her skills, which is working on improving the patient experience. I say every week at New Employee Orientation that we're a large, complex campus. We have a lot of equipment and technology, and we have a lot of machines. And at the end of all that is often a patient that is scared, vulnerable, nervous. And we want to make sure that the experience of that patient matches the world-class care we deliver. So we want to improve the patient experience. We also want to improve the visitor experience. We want to improve the learner experience because we're an academic medical center, and we want to improve the workforce experience.
Absolutely.
That takes relentless focus, and we're going to take Mary Alice and say, you know what, we want you to focus and lead the team on all of those initiatives. And she's enthusiastically and thankfully to me agreed to take on that very important role. So congratulations to Mary Alice Cohn,
Yes.
who will be our Chief Experience Officer and help move the needle in many of those areas as well.
Cannot agree more. Congratulations, Mary Alice. She's just the best woman for that job.
No question about it. And then speaking of new people and jobs, I'd like you to end by talking about two people that you've recently recruited and hired. Obviously, as you build out your team, you need important, smart, hardworking, dedicated, talented, mission-driven people,
Sure.
right?
Yes.
And you have two in particular that you brought in to help lead your team. Heather Stamey.
Yeah, Heather Stamey, wealth of experience as a nursing leader, and we're glad that she joined us in our already strong Albany Med nursing team. She spent most of her career in DC and various states, and most recently in Massachusetts. But she's our new Emergency and Trauma Services Assistant Vice President.
Okay, so she'll oversee emergency services, both adult and pediatric ED,
Correct.
and trauma services.
Yes.
So obviously synergy there, very
Correct.
important role. We welcome Heather. And then Alexandra Penzias.
Alexandra Penzia.
Penzia.
She's our newest Assistant Vice President for Center Learning and Development. CLD, very key part of our fabric in terms of in Albany Med as an academic center. She joined us from years of experience in Mass General Brigham, not too far from Boston area, and we're love to have her here. And they're already doing great work as the last few weeks.
So Center for Learning and Development, obviously very important. We're a huge workforce, largest
Right.
workforce in the whole capital region. We onboard new people every year. Continuing education, certifications, obviously help train the workforce in ALS, BLS, ACLS.
Yes.
Obviously, I'm just skimming the surface, but a very important role to make sure that our workforce is up to speed on all the things that they need to know in order to deliver the type of care we do. So
Exactly.
we welcome Heather and we welcome Alexandra as well.
Yeah, thank you.
Very good. All right. Kevin, anything else you'd like to say before we finish today?
I would just say that I think we have lots of good work to be done in 2025, and we look forward to it. I think we know our workforce we are the best and want to make us continue to be that way and improve in other areas that we have opportunities. So exciting year for us.
It is an exciting year. I've sat down with you quite a bit as you describe and articulate your vision for the nursing workforce, a professional workforce that's critical to our mission here, which is one of a kind in this region. Obviously, I'm very buoyed by the statistics from 24. I'm encouraged and optimistic that we're going to achieve even better things in 25. So thank you. I appreciate your efforts. Look forward to working more with you. I certainly appreciate your efforts as well, now more than ever. And it's cold out there, so please stay warm. But hopefully spring will be here soon. And we'll update you again in about 2 weeks. We ask that you once again, please take care of yourself and take care of each other.